Greater trochanteric pain syndrome, or GTPS, is a group of diagnoses, all of which cause pain around the outer side of the hip. Traditionally, it was often misdiagnosed as trochanteric bursitis. And indeed, bursitis can play a role in GTPS, but there's a lot more to the story. So bursitis is inflammation of the fluid sac around the lateral side of the hip. But bursitis doesn't usually occur all by itself. Most of the time, there is an underlying cause. The most common underlying causes are tears of the gluteus medius or minimus tendons, which attach to the bone on the side of the hip, called the greater trochanter, or external snapping or iliotibial band friction syndrome. And this is where the iliotibial band is either rubbing or snapping over the greater trochanter and its bursa and causing recurrent inflammation. So GTPS nags an awful lot of people in the world, and it can be a debilitating problem. It can cause pain when walking, when playing sports, when laying on it, when sleeping, especially on the side, and it can be a real life changer for a patient when we can get GTPS better. So the first step in treating GTPS is to understand the actual diagnosis. And that usually starts with X-rays of a certain variety and a specialized MRI that helps us visualize the gluteal muscles and tendons as well as the trochanteric bursa. There are some very specific physical exam tests that we do to examine for strength of each of those individual muscles, including the gluteus medius and minimus, as well as to evaluate for snapping or rubbing of the iliotibial band. And then once we've made the diagnosis, we can progress to treatment. Treatment usually starts with very conservative measures such as physical therapy or anti-inflammatories. When those aren't enough, injections can be very helpful. And the most helpful kind of injections that we've had at American Hip Institute have been regenerative injections, such as platelet-rich plasma injections that can actually stimulate healing within the tissues as well as having an anti-inflammatory effect. And when all of those things are not enough, then surgery can help with GTPS, especially if the underlying reason is a tear. When there's a tear of the tendons that attach the gluteus medius or minimus muscles to the greater trochanter, we can repair those tears with an arthroscopic surgery through little tiny keyhole incisions and repair the tendon to the bone. There are several configurations of repairs that we've invented here at American Hip Institute, including the transtendinous repair technique, that enable this to be done arthroscopically in a very minimally invasive way and with a very high success rate.